There is a muscle in your lower leg that has never once shown up on a fitness poster, never been named in a gym, and never been flexed for a photo. It sits buried beneath the muscle you actually see when you point your toes. Most people who own one have no idea it exists. It does not get sore. It does not get bigger from squats. You cannot pose with it. But this muscle can pull sugar directly out of your bloodstream in real time without asking your pancreas for permission. A team at the University of Houston put that claim through a real experiment in a real lab with real blood draws. People sat in ordinary chairs after eating and moved nothing but their heels. The result was not a small improvement. Their after-meal blood sugar spike dropped by over half. Insulin release dropped by nearly 60%. The pancreas, normally working overtime after a meal, barely had to do anything. No treadmill, no gym, no supplement. Just a seated movement most people have never been told about. By the end of this video, you will know exactly which muscle this is, why it has this strange power that almost no other muscle in your body shares, and the precise window after eating where using it actually matters. Stick around, because the part most people get wrong is not the movement itself, it is the timing. Before we go further, if you want health information explained the way it actually deserves to be explained, hit subscribe and tap the like button. It costs nothing, it takes a second, and it tells me to keep making more of these. To understand why this works, you first need to understand what actually happens inside your body in the hour after you eat. When food breaks down, carbohydrates become glucose, and glucose enters your bloodstream almost immediately. This is not a malfunction. This is the system working exactly as designed. Your brain alone burns through a significant share of your daily glucose just to keep you thinking, and it cannot store any of its own fuel. It depends entirely on a steady supply arriving from the blood. The problem was never glucose. The problem is volume and speed. Think of your bloodstream as a narrow channel and glucose as water moving through it. A slow, steady trickle is no problem at all. But a fast, heavy load of refined carbohydrate, white bread, pasta, a bagel, a sugary coffee, hits that channel all at once, and the body has to respond immediately or risk damage to the vessels carrying it. That response has a name: insulin. Your pancreas releases it the moment blood sugar rises too fast, and insulin's job is simple: grab the glucose, escort it out of the blood, and deliver it somewhere it can be used or stored. Some goes to muscle, some goes to the liver. But muscle and liver storage are not infinite. They fill up, and once they're full, the only place left for incoming glucose is fat tissue, where it gets locked away and becomes extremely difficult to retrieve. Here is where most people start to feel something is wrong, without ever connecting it to what they ate an hour earlier. Insulin, working hard to clear that flood of sugar, often clears too much too fast. Blood sugar doesn't just normalize, it overcorrects and drops, sometimes lower than it was before the meal. Your brain, which runs almost exclusively on glucose, interprets this as an emergency. It does not know the difference between not enough food today and too much sugar an hour ago. It only knows fuel is dropping, and it reacts the same way every time. Fog moves in, focus slips, a heaviness settles behind the eyes, and then comes a craving that feels less like a preference and more like a demand, something sweet immediately. This is not a willpower failure. It is a chemical alarm doing exactly what it evolved to do. Consider a man in his late 30s, an engineer, sharp and high-functioning every single morning. By 2 in the afternoon, his thinking turns to static. He assumed it was simply a long day catching up with him. It wasn't the day, it was lunch. Every afternoon, the same carbohydrate-heavy meal, the same spike, the same crash, the same fog arriving like clockwork at almost the exact same minute. He had quietly built a private theory that his focus was declining with age. The truth had nothing to do with age and everything to do with what happened in his bloodstream 90 minutes after his fork went down. Multiply that single crash by years and the cost compounds. Every spike forces another insulin surge. Every surge wears the system down a fraction more. Over time, cells that once responded instantly to insulin begin responding sluggishly, then barely at all. The medical term is insulin resistance. Plenty of insulin circulating, but the cellular door it's supposed to unlock simply stops opening on command. The dangerous part is that this can happen for years without showing up on a standard checkup. Fasting glucose can sit comfortably inside the normal range while the underlying system is already straining. A clinician who knows what to look for can sometimes spot it in a single number that looks to anyone else completely unremarkable. Consider a woman in her early 50s who came in for an unrelated knee complaint. In passing, almost as an afterthought, she mentioned she'd been waking up at 3 a.m. hungry every night for over a year. Her fasting glucose came back at the very top edge of normal. Not diabetes. Not officially pre-diabetes, but to a clinician trained to read the trend rather than the single number, it told a clear story. The pancreas was compensating, and it had been compensating for a long time. Left alone, that compensation eventually runs out. Insulin resistance progresses to pre-diabetes. Pre-diabetes, left unaddressed, progresses to type 2 diabetes, with consequences that reach the eyes, the kidneys, the nerves, and the blood vessels. This is not a hypothetical. It is the most common trajectory in modern primary care, and it is largely preventable while the numbers still look fine. Here is the part that should change how you think about all of it. Muscle is not just for strength. Muscle is a glucose disposal system, and it has a back door that has nothing to do with insulin at all. Inside every muscle fiber are mitochondria, tiny structures that convert fuel into usable energy. At rest, they idle, pulling almost nothing from the blood. But the instant a muscle contracts, those same structures shift into a completely different mode. They start pulling glucose directly from the bloodstream through a separate channel that does not require insulin's key at all. The muscle, simply by moving, opens its own door. This is why the 90 minutes after a meal matter more than almost any other window in your metabolic day. That is exactly when glucose is flooding in, and exactly when a working muscle can intercept it before it ever reaches fat storage, before insulin has to surge at all. So which muscle does this best? Not the large, visible calf muscle that bulges when you stand on your toes. That one matters, but it fatigues quickly. Beneath it, almost entirely hidden, sits a second muscle built differently. It is dense with the kind of slow twitch fiber designed for endurance rather than power, packed with an unusually high concentration of those glucose-hungry mitochondria. It was built by evolution to stay active for hours, not minutes, which makes it almost uniquely suited for sustained, low-effort glucose clearance. This is the muscle the Houston researchers were targeting. The movement was almost insultingly simple. Sit in a normal chair, keep your toes on the floor, and lift your heels up and down at a slow, steady pace. No equipment, no strain. You can do it at a desk, on a couch, in a waiting room, and no one around you would notice anything happening at all. Try it right now. Feet flat, toes down, lift your heels slowly, lower them slowly. That quiet, almost boring motion is what dropped post-meal glucose spikes by more than half in a controlled study. It is not the only option, but it may be the most accessible one, because it requires no change in your environment, your clothing, or your schedule. A short walk works through a different mechanism but produces a similarly dramatic effect. In trials comparing seated rest after a meal to a brief 10-minute walk, the walking group's glucose peak came in roughly half as high. Bodyweight squats work faster still because they recruit the largest muscle groups in the body, and the larger the muscle mass engaged, the more glucose gets pulled from circulation per minute. Even ordinary household movement, done in the right window, produces a measurable effect. 15 minutes of standing, reaching and moving while cleaning up after dinner is metabolically comparable to a brisk walk, simply because it is movement happening at the right time rather than hours later. None of these require a gym membership or a change in identity. They require almost nothing except awareness of a window most people walk straight past without noticing. The first 90 minutes after the fork goes down. One detail makes this more urgent with age. After 40, muscle mass declines gradually if it isn't actively maintained, a process with a clinical name, sarcopenia. Less muscle means a smaller glucose disposal system, which means more pressure lands on the pancreas with every single meal. The same plate of food that barely registered at 30 can produce a sharper spike at 50, not because the food changed, but because the muscle available to absorb it has quietly shrunk. This is precisely why consistency outperforms intensity here. A single after-meal walk helps with a single meal. A daily habit of moving in that window gradually reshapes how the entire body handles glucose. Cells become more responsive to insulin over time, muscle tissue becomes a more efficient glucose sink, and the system as a whole stops running so close to its limit. The short-term changes tend to show up within days. The afternoon fog lifts. The sudden, urgent craving for something sweet loses its grip. Energy stops collapsing an hour after eating. The long-term change is quieter, but matters more. Every time a muscle clears glucose without forcing the pancreas into overdrive, the pancreas gets a small reprieve. Multiply that reprieve across thousands of meals over years, and the difference compounds into something significant. The gap between staying metabolically resilient through your 60s and 70s and slowly drifting toward a diagnosis that, for most people, develops silently for years before it ever gets a name. If there is one thing worth carrying out of this video, it is this. Pay attention to the first 15 minutes after you eat. That window is doing more to shape your long-term health than almost any other 15 minutes in your day. If your fasting glucose is something you have not checked in a while, it is worth asking your doctor about at your next visit, along with a hemoglobin A1C if it has been some time. Anyone already managing this with medication or supplements should treat this as context, not as a replacement for medical guidance. The muscle was there the entire time. It was simply waiting for you to use it. If this video gave you something worth using today, do two things before you go. Hit like because it genuinely helps this channel reach more people who need to hear this exact explanation. And subscribe because this is the kind of video the algorithm tends to bury unless people show up for it early. Thanks for watching. I'll see you in the next one.